In this video, we would like to address some of the common questions, concerns, and misconceptions about herbal medicine. Modern medicine can be traced back through the years to traditional herbal remedies across all culture. However, in modern times, the current demand for pharmaceuticals is so great that harvesting herbs in the traditional manner is just not practical. Therefore, people have turned to chemically synthesized medicine in the lab. The key ingredients and medical breakthroughs were initially extracted and developed from natural living substances, like the discovery of penicillin, for instance, from which all antibiotics are derived, and without which we would not be in the current state we are today. However, sitting around and waiting for bread to mold just so we can eat it to cure ourselves when we're ill is not practical these days. To produce the number of antibiotics that we produce today, it has to be synthesized in the lab. The key ingredients were identified of what from the mold made the penicillin, and we have chemically synthesized such compounds in the lab to produce the medicine. Another example is ursodeoxycholic acid, also known as choric acid or taurusotesoshi choric acid in Korea. Naturally found in bile, this is produced in the liver and stored in the gallbladder. In Western medicines today, this is being used to treat common liver and gallstone problems, as well as showing some anti-inflammatory properties in the overall gastrointestinal tract. And while ursodeoxycholic acid, also known as UDCA for short and easier to pronounce, has been used in traditional Asian medicine for thousands of years. Only relatively recently has it been incorporated into the standard Western medical world. Where does it come from? As I mentioned earlier, it is part of bile and can be found in many different species, including humans. However, bears, and specifically the Asiatic black bear, actually produce this in much higher quantities and concentrations than most other animals. Therefore, bear bile is what is used most often. Traditionally, thousands of years ago, while people were hunting bears, you would harvest the gallbladder of the bear and therefore get your UDCA. Nowadays, though, to handle the worldwide market, however, this isn't practical, nor is it ethical, especially as the Asiatic black bear is on the endangered species list. Therefore, in the 1950s, we started synthesizing this in the lab, and in 1987, the major U.S. medical brand Herbal was patented by the FDA. What does this example show? Basically, you can take any modern medicine and trace its roots all the way back to its original, natural, herbal, organic source, from which synthesization has happened and mass production can happen. Moving on to our video, here are 3 major misconceptions about herbal medicine. 1. There are claims and rumors out there that herbal medicine is, without exception, bad for the liver. This is absolutely not true. In fact, as we mentioned earlier, the bear bile, from which you harvest the ursodeoxycholic acid, is specifically used to treat the liver and has been for 5,000 years. If herbal medicine was bad for the liver, how could you treat liver problems with it? That being said, like all medications, taking it in excess can cause severe side effects. Therefore, it is absolutely imperative, and goes without saying, one should always consult an experienced professional who can prescribe and mix the right medication for an individual's specific needs before taking anything. Second misconception that is out there is that there's a high possibility of side effects from taking herbs. Again, side effects exist for taking any medication, Western included, which is why it is imperative, once again, to always consult an experienced professional. Too many movies have given a negative misconception about the side effects of herbal medicine. However, if brewed and prescribed by an experienced professional, the actual chances of a side effect from herbal medication is extremely low. A third misconception out there is that herbal medicine is ineffective and it is not based on scientific evidence. There's a lot in that simple little sentence. So let's take a look at that. First, what is meant by scientific evidence? What do they mean by it? For scientific evidence, they mean, is it documented? Can other professionals reproduce it? Have you had examples of with and without it to show that it's effective in treating certain things? Sure. As I mentioned in the previous video, which you can find in the link below, herbal medicine and acupuncture has existed for over 5,000 years. Herbal medicine and acupuncture has been traced back at least 5,000 years. Therefore, you have records of people who have documented the effects of herbal medicine, passed it along to other practitioners, and have repeated the same cures throughout history. How is that different than the scientific evidence that this is referring to? The second aspect of that, by scientific evidence, is they're referring to clinical trials. There's copious documentation and evidence to the effectiveness of herbal medicine in treating various types of disease. And many patients throughout Asia are currently being treated through Oriental medicine alone. Currently in the US, however, herbal medicine is classified as a dietary supplement by the FDA, mainly due to a lack of clinical trials. What does that mean? Is there no interest in doing a clinical trial? Is there no interest in the research? For that, you have to take a look more at who does the clinical trials. Clinical trials are extremely costly and take a long time to come through. Secondly, who pays for them? The drug companies. After investing so much money and effort into a clinical trial, it only becomes profitable if at the end of that you can get a patent. Without a patent, there's no point in investing that much money in something that you can't sell and make a profit off of. Therefore, clinical trials have not been held on many Oriental medicines outside of very small research for academia at various universities, which again get most of their funding through pharmaceutical research and grants for generating patents. Therefore, it simply isn't financially viable to do a clinical trial for herbal medicine, as you can't put a patent on it and therefore make a lot of money by being the sole provider of said medicine. Just because this isn't a financially viable form of medicine to pursue research on doesn't mean that it isn't an actual medicine that can cure things. It's not a reason to dismiss Oriental medicine. While in countries like Korea, where herbal medicine is classified as and regulated as traditional medicine, many doctors here in the US will dismiss it because it's classified as a dietary supplement and therefore not regulated the same. That being said, in Korea, some of the Oriental medicine programs at various universities are more difficult to get into than some of the med schools here in the US. To circle back to the herbal cure for COVID-19 that Dr. Go developed, none of the patients who have been treated and cured with this medicine suffered any side effects. In future videos, we will share some of the stories of these patients, so please stay tuned and subscribe so you don't miss a single video. Please continue to be safe out there, always wear a mask in public, practice social distancing, and together we can overcome this pandemic, beat COVID-19, and have a brighter future where we can all go outside again. Thank you, and stay tuned.